dear viewers, and welcome to a new edition of our program Africa Today. Health and Population Minister Khalid Abdel Ghaffar revealed the details of establishing the largest regional center for organ transplantation in Egypt and the Middle East region. He continued the center will have 12,000 operating rooms with international designs that accept all implants and will have a national network for organ transplants and a research center as well. Dar el-Ifta on its Facebook page permitted organ donation after death to be used in the treatment of patients, saying, treatment by transferring and transplanting a human organ from a deceased person to a living person in need is permissible according to Sharia if conditions are met. More details.
President Abdel Fattah el-Sisi directed the government on Monday to establish the largest organ transplant center in the Middle East and Africa in Cairo in cooperation with international companies. Presidential spokesman Bassem Rodi said that this organ transplant center will include an automated database for transplants, patients and donors. El-Sisi's directives came in a meeting with Prime Minister Mustafa Madbouli and Minister of Health and Population Khalid Abdel Ghaffar, following up on efforts to develop the country's healthcare system. The center will be located in Cairo's new integrated medical city, which is being developed on the premises of the Nasser Medical Institute. Inaugurated July 1987 in Cairo under the Health Ministry, the Nasser Medical Institute provides low-cost or free health care to more than 450,000 people annually. During the meeting, Abdel Ghaffar also reviewed the progress on developing the Nasser Institute Hospital located in the medical city, which has a capacity of 1,200 intensive care beds and 45 operating rooms. Abdel Ghaffar also detailed the establishment of the new al-Masriyin Hospital with a capacity of 400 beds, which will provide services to about 3 million people. This hospital will be the main hospital for receiving road accident victims in Giza Governorate and its suburbs. Moreover, El-Sisi directed the officials to accelerate the establishment of strategic pharmaceutical warehouses nationwide to cover the needs of current and future need of medical and pharmaceutical supplies. The statement said that these pharmaceuticals warehouses shall be established in accordance with international standards using the latest technology, adding that the pandemic demonstrated the need to boost pharmaceutical production across the continent. Furthermore, the statement said that El-Sisi directed the government to accelerate the application of financial incentives for medical personnel and the nighttime operation of clinics. El-Sisi added that part of the clinic's revenues will be allocated to doctors and medical staff in a movement to provide additional incomes for medical personnel to reward their efforts. Earlier this year, the Egyptian Medical Syndicate praised the head of state's directive to increase the monthly allowances given to medical professionals by 75% at a total cost of 2.25 billion Egyptian pounds as part of government efforts to support members of the healthcare sector amid the coronavirus crisis.
To shed more light on the issue, we are very much delighted to be joined over the phone by Dr. Magdy Adly, Senior Manager in Healthcare and Quality Control Management. Good afternoon to you, Doctor.
Good afternoon. Good afternoon. Thank you for having me this afternoon.
Thank you, sir, very much for being our guest for today. Dr. Adly, what is the significance of establishing the largest organ transplant center in the Middle East and Africa in Egypt?
If we are talking about establishment of the largest organ transplantation center in Middle East and in Africa here in Cairo, the capital of Egypt. So we are talking about a mega project. And when we are talking about mega project, we are talking about center containing like 12,000 operation chambers or operation rooms.
Yeah.
Prepared according to the recent global design, which will be available for all kinds of organ transplantation, like heart, kidney, liver transplantation. In addition to having a national network for organ transplantation and a massive research center for that purpose. I mean the recipients and donors. And for the first time, we will have the authority for lung transplantation in Egypt for the first time. That will be in a medical city of Nasser City. And that is according to the direction of our political leadership, His Excellency Mr. President Fattah al-Sisi, who has ordered intensifying efforts in that direction powerfully, regardless to the cost, which actually will be of high cost. But we as Egypt and our president has a great role in a region as Arab world or Africa as well. And we supposed to be to have the leadership responsibility mainly in that mega project, and for sure that actually and definitely providing a good and qualified medical service for Egyptian citizens and Africa and Arabic citizens as well.
Sir, also President Sisi ordered intensifying the efforts aimed to transfer Egypt's health and medical expertise to other African countries. Would you please tell us more about this issue?
This is a good question, by the way. Transferring Egyptian health and medical expertise to other African countries, as I told you, Egypt, from the historical responsibility rule, and it has assist and continue in that direction, by the way, for providing a medical and health expertise, and even providing some African countries having some little internal financial problems with medical donations. And that because we are brothers, and we under one umbrella, which is an African Union, and that was clear in COVID-19 pandemic crisis, when Egypt sent a lot of medical equipment like face masks and sanitizers for many countries, not even African countries, but also European or Asian countries. And we would like to escalate that cooperation, by the way, and in all different sides of medical fields. In Africa, mainly as medication market sharing or training medical teams in our universities, according to the recent global guidelines, and we are welcoming for that. We are welcoming with our brothers in Africa to come and getting medical services in our hospitals.
Of course. Dr. Adly, Egypt actually is aiming to become a leader in the field of healthcare services and research in the Arab world and Africa. What are the steps taken to fulfill this?
This is a good question, and Egypt aims to become a leader in that field of healthcare service and researches in Arab world and Africa through many steps. In fact, we started that since long time ago. I think we started 8 years ago, since Mr. President taking over the reins of state, or taking over the responsibility. Through he thought about health sector and how we develop and enhance medical and healthcare services, and become a leader in the region through taking many steps. For example, the presidential initiative, including 100 million health initiative.
Yes.
And that 100 million health initiative containing early discovering of currently disease like hypertension and diabetes and obesity. Also, and the treatment for these disease, which actually the main cause of 70% of mortality yearly,
Yeah.
Some initiatives like early diagnosis of breast cancer for women. Some initiatives like initiative for schooler students for early diagnosis of anemia, stunting and obesity. Initiatives for hepatitis C.
Yes.
And implementation of comprehensive insurance system for sure in some governorates.
Yeah.
Also through transferring the technology of manufacturing vaccines like COVID-19 vaccine in Egypt to cover vaccination of our population and exporting to our brother African countries through some agreement with African Union.
Yeah.
Also through transferring the technology of production of blood derivatives and plasma derivatives production, transferring the technology of manufacturing raw materials of medical in Egypt to consume the hard currency for sure, and establishment of many research centers in Egyptian universities and even pharmaceutical production companies to get recent scientific studies globally and developing the final product to be suit with the demand.
Yes. Sir, Egypt is ramping up the production also of Sinovac coronavirus vaccine as it aims to become a hub for vaccine exports to the African continent and protect its own population. Would you tell us more about the latest development concerning the spread of the coronavirus in Africa?
This is a good question. As I told you, if we are talking about vaccination, here in Egypt, we get a good percent of vaccination, like 80% of targeted population. But the problem in Africa, the percent is still not enough for more protection. So Egypt start for production of vaccines of COVID-19 and start for exporting the vaccine to other to our brothers of African countries.
Yes.
And we hope that all African countries getting the vaccine of COVID-19. Yes. So it will be something very simple and doesn't have any harmful side effects. That's what we are hoping.
Indeed. Doctor, what are the measures taken here to support the African countries, especially in regard of the health coverage tackling disease such as hepatitis C?
This is a good question. Hepatitis C, by the way, is a good experiment. And it's supposed to be transferred to other countries, to other African countries, because elimination of hepatitis C in Egypt was one of the greatest experiments all over the world, and should be transferred to other countries, including African countries, because in that initiative, which was one of 100 million health initiative, we as Egypt and other international partners made a good job and did well. Yeah. And we made the largest scanning and largest number of hepatitis C tests all over the world, and that was proved by global recording redometer.
Yes.
And on the other hand, Egypt gets also a good benefit from that initiative, rather than elimination of or limitation of hepatitis C.
Yes.
It received a massive database of population and the percent of their ages and classifying them, elderly people, young people, children, and the newborn, and that helped state, by the way, for planning on long run or putting a long run plan and a future medical plan,
Yes.
like the plan for 2030. And that is good for how many we need and how much it will cost. That which is called the statistic background plan.
Indeed. Dr. Magdy Adly, Senior Manager in Healthcare and Quality Control Management. Always a pleasure to listen to your precious input, sir. Thank you very much. And a short break, and after that we'll be back, so stay tuned.